Hello, Dimsdale. I'm Jet You Betcha with today's editorial, which technically makes it a Jetatorial. Senator Ron Wyden has asked the Department of Justice to investigate 4 major operators of youth residential treatment facilities, Universal Health Services, Acadia Healthcare, Devereux Advanced Behavioral Health, and Vivint Behavioral Health Care. Wyden's Senate investigation revealed evidence of abuse, neglect, and substandard care, with allegations that some facilities provide inadequate services, violating Medicaid rules. Wyden also raised concerns that states may be breaching the Americans with Disabilities Act by placing children in these facilities instead of providing home-based care. While some companies disputed the findings, Wyden called for DOJ action to address potential civil rights violations and fraud. In other developments, as Hurricane Milton nears Florida's west coast, residents face potential power blackouts and cell service outages. With the storm expected to make landfall near Tampa, satellite communication options are being promoted. iPhone users with models 14 and above can utilize satellite messaging for emergencies and location sharing. Though performance may vary, Android's Pixel 9 models will activate similar services soon. Elon Musk's Starlink, in partnership with T-Mobile, offers free direct-to-cell service for areas affected by the hurricane, helping users stay connected even during outages. Both Apple and Starlink advise users to operate outdoors for optimal connectivity. In other updates, a study in atherosclerosis, thrombosis, and vascular biology found that COVID-19 can double the risk of heart attacks and strokes for up to 3 years after infection. Researchers examined over 11,000 COVID-positive individuals from the UK Biobank, comparing them to 222,000 non-infected participants. The risk was even higher for those hospitalized with COVID-19, comparable to risks seen with diabetes. The study noted that blood type might influence outcomes, with O-type showing slightly lower risks. Interestingly, people taking low-dose aspirin while hospitalized did not see an increased risk. Researchers are still investigating how COVID causes lasting cardiovascular damage. In another update, as interest in anti-obesity drugs like Wegovy grows, more employers are considering offering coverage for these medications. Currently, many cover GLP-1 drugs for diabetes, but fewer do so for weight loss due to high costs. The list price for Wegovy is around $1,350 for a month's supply, making coverage decisions impactful for premiums. Larger companies are more likely to offer coverage, often with restrictions like prior authorization or weight management programs. Rising prescription drug costs and healthcare expenses continue to push up premiums, with many companies seeking cost-cutting measures. From all of us here, stay classy, Dimsdale.